Hello, thank you so much for joining me, Ms. Paulina Lewis. Paulina Lewis is the director and education trainer for 211 Big Bend, and we're so excited to have you. Thank you.
Thank you for having me.
Yeah, so for the viewers who are not familiar with 211 Big Bend, can you just give us a brief overview of what that is?
Yes, absolutely. 211 Big Bend is our local crisis counseling center, and we answer several different hotlines and we provide a lot of different services for our area.
And is it only for the Tallahassee, North Florida area, or how far does it extend?
We serve the 8 counties of the Big Bend, so we serve out to Franklin County, so like St. George Island. We serve Jefferson County, Wakulla, and of course Tallahassee, and some of the other outlying counties as well.
Now, what would be the importance behind having 211 Big Bend? I mean, we know you can call 911 if you need help, but 211 Big Bend is specific to what and what incident?
So it's really general crisis counseling. So we have a couple different hotlines. The first one, it's our bread and butter hotline. It's Helpline 211. And that's our 24/7 crisis counseling and information and referral line. So if someone, say, is struggling with domestic violence, their partner's hurting them, or maybe they're hurting their children, that person can call in at any time, 3 a.m., 1 p.m., whenever's most convenient for them, and get crisis counseling, get resources and the local resources. So places like Refuge House, rather than calling like maybe a national number where they would still have some local services, but we know them intimately and we have partnerships with those agencies.
And so some of the individuals who are calling in, you develop a relationship with them. Is that what you're saying? So they become a client, or?
Sort of, yes. We do have some callers who call us on a more regular basis. They rely on our services. There's not a lot of mental health services that are at low cost, and a lot of people in our community just can't afford routine mental health services. So some of our callers call us back routinely for those things.
But is it a substitute for mental health counseling, or do you all still advise people to get counseling, but they still have the opportunity to call 211? Like, how does that work?
Yeah, so it's not a substitute for like a long-term therapist or a counselor in the sense of forming a more personal relationship with like a mental health professional. Um, our crisis counselors are considered paraprofessionals, so they're not licensed, but they do have extensive training in crisis counseling and different topics within that. But we do still follow a lot of the same ethical tenets, a lot of the same counseling techniques that a therapist would, just on a shorter term basis.
Has there ever been a time where you have a repeat caller and they haven't received the help that they need, and so you have to, you know, bring in another organization to assist this person?
Yes, sometimes we do. Sometimes that happens if someone is at immediate risk to harming themselves. We may need to kind of work on their behalf. We usually try to work with that person with their consent, of course, and try to get maybe law enforcement or our mobile response teams involved, depending on the situation. But we also can provide referrals to people, to our local therapists. We have a mental health directory on our website as well, that people can go to and find other local therapists, clinicians, social workers, those kinds of professionals.
Thank you. And then just a little bit about mental health.
Mhm.
What is mental health? And mental health versus a mental issue versus a mental crisis. Can you break those down for people to understand how and when will 211 benefit them?
Absolutely. So mental health in general is just kind of, I guess, liken it to physical health, right? The brain is an organ. So sometimes that organ has trouble doing what it's supposed to. Maybe it gets overwhelmed, especially like when you're a student, you're a new parent, you have some kind of life event happen, where that organ, your brain, gets so overwhelmed by the input that things just don't work like they normally do.
Mm.
And unfortunately, sometimes people get to that point where there's just so much stress in their life, so many overwhelming events that they realize that they're not acting like they usually do. Sometimes people will call and they'll say, I'm not sleeping like I used to. I'm not eating like I used to. I'm just not myself, and I know something is wrong, and I can feel it, but I don't really know where it's coming from, and I don't really know what to do.
So is that where the crisis starts to happen?
Yes.
Okay.
And so for us, we consider crisis self defined. So sometimes we have callers that are in high school or they're in middle school, even. They're very young and they have their first boyfriend, girlfriend, partner, and they break up. And for that person, that's the first time they're ever experiencing it. And some of those callers have suicidal ideation because that overwhelming life event is so intense and they don't have the tools yet to really navigate that. And so that's what happens. But that happens to adults too, right? So someone who's failing an exam for the first time or failing a class for the first time, and they've never had that happen to them before. They were always an A student, and that F is just so overwhelming that it takes over.
Mhm.
There's so many other things that happen, but generally, our counselors know that crisis is self-defined. And really, what we believe at our agency is that crisis is any kind of event that impacts your normal functioning.
And at what point do you say, okay, now this is an issue and you need further guidance and help?
Yeah, we usually let the caller determine that. So it's up to that person to kind of direct us and direct our counselors to how they want to handle their crisis. Some people just need to talk it out. Some people, they're like, okay, we're going to talk for 20, 30, sometimes 60 minutes. And our counselor helps them process whatever they're going through. And sometimes that's just what that person needed. Maybe that's just what they needed that day. Sometimes that person may call back and say, okay, it's still not resolved and I need something more. Other times, the caller is at a point where talking is just not enough for them in that moment, and they need more. And that's when our counselors will start to try to develop a plan with them and figure out, okay, is it resources that you need? Is it safety planning? Whatever else that person may need.
And then just with 211 Big Ben,
Mhm.
what safety measures are in place so that a caller's information about what they've discussed with you all isn't on the internet or someone can find out?
Mhm.
What happens with that?
Yeah, that's very important to us. Confidentiality is extremely important to us. We also answer the 988 Suicide and Crisis Lifeline for our region. And one of the main tenets of that line is confidentiality as well. So all of our systems are HIPAA compliant. We're not a healthcare provider, but we follow that standard to make sure that whatever information we collect from a caller is maintained in a safe and secure environment.
And then would you say that the stigma around just mental health in general, is it as prevalent as it was, I would say, prior to COVID? After COVID, it just seemed as if everyone was just like, hey, I'm having a mental health crisis. I need help. Has the trajectory towards I need help and I'm calling 211 Big Ben changed, or is there still a large stigma around needing help?
We're still seeing some stigma. I think that's going to take a much longer time to really tackle, but we're noticing more and more people feel more comfortable about saying something, speaking up. Um, I'm not 100% sure why, but I
Mhm.
would guess that part of the pandemic, that collective feeling of helplessness, probably opened up a lot of people's eyes to how some people feel on a day to day basis. That helplessness of, I don't know what to do. So much is happening, and normally I'm okay, but now I'm not. And I don't have any other way to vent, to plan, to, um, you know, figure stuff out the way that I used to, because the world has changed so much. And, now that we're kind of coming out of the pandemic, I think there are still a lot of people who recognize or that they're still having those effects that or maybe that they recognize that they were always having those effects, but I know that part of the rhetoric around the pandemic was connecting with others, staying connected,
Mhm.
even if you were, quarantining. And I think that part of the message has been helpful.
Mhm. Now, would you suggest for a person who's going through a crisis, to immediately call 211 Big Ben? And like, is there a process to where it's like, well, you need to dial 911 instead, or how do you all have that differentiation in between?
That's a great question. So, especially as we're, I guess, as a country, starting up and getting more familiar with a service like 988, for example,
Mhm.
there is like some of that confusion, right? So 911 is for immediate emergencies, right? Someone life is in immediate danger or could be. There's some other kind of safety concern, or there's really not any other way to keep a person safe. Um, but 988 is when a person is still physically safe, but at the same time, we do have people who call who are not physically safe and need our assistance to keep themselves safe. We've had callers say, "Hey, I've actually done something to hurt myself, and I realized that I don't want to do this. Um, can you help me? Can you help me get to safety?" And when a caller asks for it, we will help them with that. Sometimes we get callers who are unfortunately to a point they're almost inebriated or in a mental state where they are not really able to make decisions for themselves, similar to being like drunk or intoxicated. And sometimes we do need to step in. It's very rare, but we will work with local mobile response teams or law enforcement, whatever's appropriate for the situation to get that person to safety. We always try first, though, we try to leave law enforcement to last resort. So we try to sometimes ask, is there anyone else in the house? Do you have a roommate, a parent, a friend that you trust that can help you get to the hospital, or that can get you to a mental health facility, or who can kind of help you through whatever else you're going through.
And then what about, I mean, we have about 10,000 students at Florida A&M University. Um, I mean, with multiple different crises happening throughout their life from the time that they come to school and when they leave. And not just, it's not an isolated incident. Colleges across the country, whether you're getting your bachelor's, master's, or a PhD, you start dealing with things in between. So
Absolutely.
how just in North Florida has 211 Big Bend supported colleges, FAMU, and Florida State University, TCC, just students across the region.
Yeah, so one of the things that we do is with TCC, we have a connection with their counseling center, and we're familiar with the counseling centers at FAMU and at FSU, but we have a partnership or a relationship with the counseling center at TCC. And one of the things that we do for their students is if we know that a caller is a TCC student, we will get them connected with their counseling center. We also have the referrals for the other counseling centers in the area for those colleges and can connect those students with them. We also have a lot of students who are volunteers for us and answer our hotlines, and they can very much, I'm sure you can guess, they can relate to those struggles of students. And I always tell our new counselors that having those similar experiences, while we don't disclose those on our lines, we're not a peer support line, that's a separate kind of different service. On 211, we're not a peer support line, but you can still use those experiences to connect with your caller. And really, it's the connection that helps us do what we're here for.
That's awesome. So the counselors and it's a diverse setting, men, women, middle age, older, younger, that can support individuals.
Yes.
And about how many counselors are on the other end?
I would say, I think right now we're at about 50 or 60 counselors. We have both volunteers and paid counselors. And we also have a couple different care coordination programs. So there's the My FL Vet program, and that is for veterans, and they're actually a peer support service. So we have veterans who have come to us, who work with us, and they can use their experiences and will speak to their experiences, in combat or during their tenure in the military to help our veteran callers kind of navigate the VA, navigate being back home. And we have a Help Me Grow program that helps parents with children 8 or younger who might be experiencing like developmental or behavioral like difficulties. And we also have an Alice and a Lift program that helps people who are transportation disadvantaged and food insecure. And so those different programs, they all work within our agency to serve our community in a lot of different ways. And our staff is so diverse, but we all care so deeply. So many of our current counselors, our care coordinators, and our counseling staff, a lot of them have been through the things that our callers call about. And they're so passionate about helping others. That's the one golden thread that really runs through our agency, is just the passion for helping others. And I see that so much because a lot of us, like I said before, are peers. A lot of us have experienced suicidal ideation. A lot of us have experienced domestic violence, PTSD, ADHD, all kinds of depression and anxiety, all different kinds of mental health disorders and concerns.
Awesome. That's amazing. I'm curious, just what would you say the goal of 211 Big Ben is? Is it to save lives, or is it just to provide that extra ear of support? What is the goal?
I would say our main goal is to be a source of compassion, a source of care whenever someone needs it. Because most of our lines are open 24/7, 365, and our agency really operates 24/7, 365. Our goal is to make sure that our callers receive care and compassion and resources and information, of course. But when those aren't available, or that person's maybe not interested in those, our end goal always is to be a listening ear.
And then what about the vision from 2024 and beyond? What's the vision for 211 Big Ben?
Our vision is to continue to do what we're doing and expand and help people in other ways. So we have an ASSIST workshop. ASSIST stands for Applied Suicide Intervention Skills Training, and it's a 2-day workshop. And it's really, we put it on for the community as well, but we also have our counselors go through it. And it's another layer of teaching people how to talk through a suicidal crisis, how to help their family member, how to help their friend navigate those sometimes really scary thoughts. And we do, other community workshops and trainings, and that's an area that we're hoping to expand as well. But we also have expanded how we receive caller contact. So we have the phone number, but people can also go onto our website, 211.org, 211bigbend.org, and web chat with us on our various hotlines. And they can also text their zip code to 898-211 and receive texting services. And the web chat and texting, though, is just for referrals, because we find that for us, at least for right now, our counselors are best at crisis counseling over the phone.
Now, I know we mentioned it's a simple phone call. Hey, I need help. How do you all step in? Let's just say if it's a single mom calling and she's asking for specifically mental health counseling.
Yeah, so I've had that call. So we have 2,300 referrals in our database, really over 2,300 referrals in our database. And oftentimes what we find is that people need more than one. So they'll call, that person will talk about how stressed they are. The kids are stressing me out. I don't know what else to do. We'll talk to that person, figure out, again, from their perspective, what is the most pressing thing? Usually we'll start with one kind of topic, give them a couple referrals. Okay, what's the next thing? What else is going on? And usually what happens is as we connect more with that caller, they start to open up more. They feel more comfortable with us, and they really understand that we're listening to them, and we can provide more and more referrals to them.
And then when you mention just the word referral, who are they being referred to?
Yeah, so it's local partners. So I mentioned before Refuge House. They're one of our community partners. We're also familiar with, and we have Family Promise, for example, in our database, and they have several programs within that agency. So depending on the needs of the caller, we'll look through our referral database and find what could be appropriate for them, and we'll collaborate with that caller to see if that's something they're comfortable going to.
So even if a person does not know exactly who to call, 211 Big Ben can assist with that.
Yes, and that's the biggest difference between us and like a Google search, for example. We really help break down and figure out, okay, what is appropriate based on the information that those partners give to us. So they give us a description of their services, their intake, all of that information, and our counselors have all of that at their fingertips. It's also accessible on our website. But we know our counselors are trained to search through that database and to listen to a caller's needs and really help them figure out who would be appropriate for them, because it can be confusing.
Can you just give a brief example of those who are looking for help through chat? Is it, hi, can someone help me? I'm having a mental health crisis right now. Or is it just that simple to get in contact with you all and someone is immediately calling? How long does it take to receive a call back?
Yeah, so we try not to have people need to call back. Our answer rates, I'm very proud to say, it's like one of my favorite numbers. Our answer rates are pretty consistently over 90%, and that means that we answer most of our hotline calls within the first 3 rings. And that is a metric that we've maintained even throughout the tornadoes that just hit our area.
Wow.
So we were receiving thousands of calls. And I want to say we received over 3,000 calls in just a couple weeks, whereas our normal volume is about 3,000 in a month. So there are some other different ways that people can contact us.
Yeah, and I think it's important just for the community at large and people who are listening to know they're not alone. And multiple people just in Tallahassee alone, 3,000 calls, right? Yeah, just in Tallahassee alone, people are asking and needing help. So how can those supporters or people who are just interested in knowing what they can do to be in support of 211 Big Ben, are there certain ways that people can actually help or support the organization?
Yes, absolutely. So on our website, we have a button at the top that says volunteer. And so if someone is interested in volunteering and becoming a counselor, that is, in my opinion, I'm a little biased. I used to be a volunteer. I started as a volunteer with our agency.
Nice.
That's, I think, one of the most rewarding ways to give back, but it's not for everyone. I know that. So, of course, people can donate to our agency. People can spread the word. That's probably one of the most impactful ways to really support us, is to support your community, support your neighbors by sharing our number if you know someone who's struggling and needing support, needing that compassion, needing that care. I've had parents say, I didn't know what to say to my child. I didn't know what to say to my family member. So I gave them your number. Was that okay? I said, yes, absolutely. Because sometimes we don't know what to say and we're scared that we're going to say something wrong, or we don't know what resources are available. So just sharing our number, sharing our contact information is a great way to support us.
And then just remind me, I know you mentioned something with FAMU and TCC. Is there a partnership or a program that's going on already between FAMU and you all?
Not an official one, I don't believe.
Okay.
But we do have, like I said, connections within the university, and we are familiar with like the counseling center and different counseling services within the university.
And how, in the future, how can FAMU partner with you all? How does that work? Is there an opportunity there?
Yeah, I know that one of the things that we've always been interested in, and this is a long kind of collaboration, is forming a relationship where we can have interns, because we've seen so many counselors who come to us from like a social work background. They're in the School of Social Work, and they volunteer with us, but they sometimes will leave us because they have to do an internship opportunity. There are some barriers for us being used as an internship because we're not face-to-face. However, we're seeing more and more clients and our callers seeking out services that have telehealth, that have web chat services, texting services, like a therapist that can do that with them. So we've seen callers asking a lot for those services, and we're seeing more providers offer that as well.
Okay, that's awesome. That's a wonderful thing to know. Now, are there some things I've asked a lot of questions, but just from your perspective, is there something, a message that you want to make sure people who are listening, that they understand about 211 Big Ben and just how much you all love the community? What message are you sending to your viewers who are listening?
Really, that we are a homegrown agency. We've been in our community in Tallahassee since 1970.
Wow.
And we have always been local. We've always been locally run, always taken our counselors from our local pool. And we see so much value in that because Tallahassee and the Big Bend can be a little different than the rest of Florida. And sometimes it's hard to understand what someone's going through, what our community experience is when you're not from here, when you don't live here, whether that's part-time as a student or full-time as a resident. But we see so much value in our local resources and our local counselors and our local people. And I guess really the final kind of point to that question is, again, just reiterating that we care. That's really what our agency is here for, to be a source of compassion when callers may not have that in their lives.
That's important. Thank you. Thank you. Now, last question. The support that you're also receiving, local and state support. So is the state legislature involved at all with just supporting you all, or is it just local, city? Where is that coming from?
Yeah, so it's a little bit of both. There are 211s all over the state of Florida, and we do have like a coalition. We all work together to work with the state legislature to provide funding, to provide some messaging, to manage, our grants. But of course, we do have local connections with our local city commissioners and local officials as well.
Awesome. And then can you just take me back to that start date? Was it
1970.
Okay, and then 211 Big Ben, it started to support people who are having mental health crisis, or is that where it began? Can you just kind of walk me through that?
Sure, just like a brief history.
Just a brief history.
Brief history.
Yes.
So we actually started in 1970 at FSU as a grad student project. It was manned by volunteers, and the original name was Telephone Counseling Service, just TCS. It was like maybe a handful of volunteers providing this service. And then we broke away from the university 6 years later. So in 1976, we became Telephone Counseling Referral Service. So there are some people in the community who still know us as TCRS. And then in 2003, I want to say, we changed our name to 211 Big Bend, and we joined the national 211 network. So 211 is a little bit like 911 and what we're seeing now with 988, where before there wasn't a 911, you had to call your local law enforcement. Similar with 211. Before, you had to call your local crisis line, and then 211 started to become a more known number. We joined that network, and now we're at the point where 988 is the new 3-digit number, and people are starting to get familiar with that.
Okay, awesome. Now, I don't know if they say there are no dumb questions, so I'm just going to ask. If I lived in Tallahassee, but now I've moved to Orlando, but I want the support from where I'm from, can I still call 211 Big Ben, or is it just hands off? You have to live here only to receive the help?
No, not at all. So we actually have some callers who prefer to call us, and usually those are some of those more frequent callers. So we have some callers who live in other states and cities. They maybe their region isn't covered by a 211, or they don't have like a local crisis line. And some of them prefer to call us, and I'm sure there's other 211 centers who are the same.
Would that be a part of some of your community partners, or are the community partners just in support to help the organization thrive?
Can you repeat that?
Community partners.
So we have different community partners, and they're in our resource database. and we like take their information and make sure that it's accurate, make sure that it's up to date. And the different 211s around the state do the same thing, so it's
Okay.
regionalized.
Okay.
So say, for example, you were saying before, you're in Orlando. If you
Mhm.
just dialed 211, you'd reach the Orlando center and get those local
Okay.
resources.
Okay.
But if you wanted to, say you preferred to call us, 211 Big Bend, you can reach us through the 10-digit number.
Okay. Okay. That's good to know. That's good to know.
Mhm.
And let's just end on a very positive note, because mental health is such a heavy
It
topic.
is.
Can we speak to accolades and the things that 211 Big Ben has achieved since the creation and the development of this organization?
Yeah, so over the years, we have just continued to thrive. We have continued to grow our model, and our counseling model and our training model is one that's used around the nation. One of our founders is a very prominent suicidologist. And because we started with FSU, we have some of those still connections with the kind of suicidology community, so the study of suicide. So there's, I know you said, let's get away from the heavy. Sorry, bring it
It's
back to
okay.
some heavy. But that's one of our connections.
Mhm.
But from that, we have just continued to try to make connections within the community.
Mhm.
We have continued to try to support our community. And I can very proudly say that as we've had more hurricanes, our agency has been open and available, and our number has been open and available through all of those. And we very much intend to continue that.
And then there also are some awards that you all have received through your service.
We
Do you
had
know
like
the names?
I'm not 100%
Okay.
on some of them. I know that we won a Chamber of Commerce award,
Oh, awesome.
and we have been recognized. We're accredited by the American Association of Suicidology and Inform USA, which is the Information Referral
Mhm.
Association.
Okay, that's amazing. Well, just from my perspective, I know you all are needed. And without you all, I mean, I know that there would be a lot more suicidal attempts, students who feel left behind, parents, single moms, the vets, everyone who has depended on your organization is definitely um, just, I hate to use the word thrilled, but in need of support.
Absolutely.
And so we thank you for having this conversation with us. We thank you for bringing enlightenment and just informing the community about what you all can do and how you all will continue to support and continue to exist in the North Florida community. So thank you so much for I'm grateful for having you.
Thank you. Thank you for having us.
Yes, and
Thank
we
you.
will welcome you back when the time is necessary.
Sounds good.
Thank
Thank you so
you.
much.